Good morning, and thanks for the introduction, and thanks for joining me for this presentation on our experience with synthetic MR. Just to warn you, this is not a technical talk. So to start, I'm going to just briefly describe what synthetic MR is. The synthetic MR sequence design uses multiple echoes and saturation recovery times to measure the tissue-specific parameters, R1, R2, and proton density. There is then a post-processing step, which produces both qualitative and quantitative images or maps, as well as calculated data, which can be presented in a variety of different ways. So we've been using this platform for our evaluation of synthetic MR. As we all know, any new software is only as good as its ease of use for us. If it's not easy to use, we will likely not use it, no matter how good it is. Lots of ease of use features are visible here. Icon shortcuts and right-click features launching, to name a few. We have the most experience with the 2D sequence, which has the parameters listed on this exam card. Recently, a 3D sequence has been made available to us under a research protocol. I will show a bit on our very limited experience with it towards the end of this talk. So just to speak practically, most people who would or are considering synthetic MR are likely most interested in this, time savings, getting the standard images in less time. That is pretty straightforward and understandable. And as you can see, there's a pretty significant time savings compared to conventional imaging. And if you add in smart speed, which is the Philips AI reconstruction technique, there are even further time savings. What I'm going to focus on, however, mainly for this talk, is the other side of the synthetic MR coin, additional contrasts and quantification of tissue-specific parameters, which can be displayed as maps, graphs, and/or statistics. To start with, however, if you are interested in using synthetic MR images to replace your standard protocol, this infant case is a good example of the potential comparable image quality, even for subtle structures like the posterior limbs of the internal capsules seen here. And what about pathological findings? This HIE case is another good example. This child had a two-year follow-up MR after her initial injury seen here. And it's no surprise that there were some focal areas of encephalomalacia and gliosis in the previous injury regions, which were comparatively visible both on the conventional MR and on the synthetic MR images. Now moving on to the augmented imaging side of the synthetic MR coin. Multiple additional sequence weightings in one acquisition, the standard T1, T2 proton density and flare on the top, and in addition, a whole range of inversion recovery sequences, which, although not obviously standard, if you have a use for them, they are available. And now on to what I see as the biggest potential feature of synthetic MR, image maps and quantitative data of tissue characteristics instead of image contrast features to help make diagnosis. Here you see the relaxivity maps for R1, R2, and for proton density, as well as the plots and locations of their major tissue classes. And if you draw a region of interest in these normal structures, the pixels map to their expected locations. So first, a small disclaimer on this slide. What I'm proposing here is not vetted out yet and represents some of my initial impressions on this. After reviewing several cases with these tissue plots, it seems that most pathology ROIs seem to map to a region or band generally in this location. This may or not be for real, but I'm going to now show a few cases that have led me to these predictions. First is a kid with neurofibromatosis 1 and multiple UBOs. As I suggested, UBO ROIs seem to localize to the proposed pathology band. Also interestingly, even though they all look the same on flare, this one in the cerebellum has a lower proton density value than the other two. And here's a really interesting case that I want to spend a little time with. This child has a focal cyst and enhancing nodule temporal lesion, as well as a non-enhancing solid midbrain lesion. I drew 3 ROIs to better characterize these components. The first is in the cyst, which had the expected CSF localization on their plot. The next within the enhancing nodule, which had a kind of unclear broadband localization, which most interestingly was about the same as the non-enhancing midbrain lesion. And here is another case in which I sampled a few subcortical tubers. Also interestingly, they basically look the same on MR. However, there is some apparent variability on their plot location. Not sure if this reflects ROI placement, or could there be some intrinsic morphological differences? Moving on to the other group of synthetic MR images, those of segmented tissue classes. 4 that represent normal tissues, gray matter, white matter, CSF, and myelin, and 2 that represent pathological tissue. 1 that is labeled non-gray matter, white matter, CSF, or myelin, which I call the abnormal tissue image, and the other labeled as excessive parenchymal water, which I call the edema image. And just to validate the accuracy of tissue classification segmentation, here's that newborn I showed earlier, but this time showing the white matter and myelin maps in comparison to the conventional T1 and T2 images. And here is a gray matter map, which nicely identifies this small heterotopic gray matter focus. So what about the segmented maps of pathologic tissue? Here I'm showing the map which highlights everything but normal or expected tissue. As you can see, it definitely finds the white matter changes in this patient. And just to start piecing things together, I drew regions of interest in the normal appearing white matter to get this expected plot of the normal white matter location, and then in the abnormal white matter to get this plot of values within the suspected pathology band. Here's one more example with some subtler abnormalities picked up by the abnormal tissue images, as well as another one look at this patient from earlier with their fairly subtle cortical areas of encephalomalacia and gliosis, which again appear on the abnormality image that I was discussing before. And one more final case highlighting segmented tissue pathology maps. Here are diffusion and T2 weighted images from a neonate in a lot of clinical distress. It might not be so obvious here, but there is a diffuse imaging abnormality, mostly involving the right cerebral hemisphere. So in these subtle cases, having another set of images can be very helpful. Here you see the conventional T2 done on day 9 of his stay, as well as the abnormal tissue image and the map of excessive parenchymal water, aka the edema map. Looking at these synthetic MR maps, the location and the extent of the findings is much more apparent. And just to confirm, I have the imaging from his admission MRI, which were normal looking. When adding in the before and after tissue plots on this patient, one interesting thing to consider is whether there's a potential role for using them to quantify disease, hopefully resolution or potentially progression. Now, just to round things out a bit, a few slides on the graphical quantification features. Several expected age-related graphs are available with automatic quantification and graphing of patient values. Here's a normal plot for this 11-year-old. And here is an abnormal set of plots in this patient with ventriculomegaly. Obviously, CSF volume is very increased and the parenchymal brain fraction is much decreased. And here's another one for an 8-year-old with a lower than expected brain parenchymal fraction and myelination also at the lower limits of normal. And here is that same type of quantification information presented in a tabular form. So just to finish off, as I mentioned, the 3D version of the SyntheticMR sequence has been released as a research tool. All the outputs are the same as the 2D sequence. Again, the sequence is AI reconstruction compatible with SmartSpeed, which has really positive effects on the scan time. We have some very limited experience trying it. Here's one case of a child who initially presented with multiple germ cell tumors, pineal and paracellular regions, that has been undergoing some treatment with some expected changes within these lesions. We tried the 3D image on his follow-up scans with comparable image quality. And here's another look at this patient evaluating the paracellular lesion here. And so I've zoomed in on this slide to give you a good look at the comparable image quality. One interesting thing we have recently noticed is that in comparing our standard 3D volumetric imaging sequences to the synthetic 3D, that the pulsation or loss of bright CSF signal that we occasionally encounter in our standard sequences is not also seen on the synthetic images. And so here you can see very nice, pristine CSF on these images. And so not quite sure yet whether this is something that propagates throughout, but this can have very good clinical implications. And then moving on, the next steps for evaluating the 3D sequences would be their tissue-specific features, as I presented earlier for the 2D sequence. Thanks again for your time and for listening to our experience on SyntheticMR. Happy to take questions, and feel free to contact me if you have any other questions or comments following this lecture. Thank you.